Telehealth has been huge for us in that we are a very rural state in South Carolina. 32% of our state falls into rural locations, and it can be very difficult to find psychiatric providers. In South Carolina, last I looked, I believe it's about 16 to 17 of the 46 counties don't have a psychiatrist located practicing within that county. So there's a huge need, certainly, and we really do feel like telehealth enables us to reach some of those patients more efficiently.
Psychiatric telehealth enabled collaborative care management model is actually a model for treating behavioral health issues within the primary care physician's office. Telehealth is used in this model of collaborative care to reach people we might not otherwise get to.
It's been shown for decades now, primarily with research coming out of the University of Washington, that there's clearly not enough mental health providers, and there can be ways to try to fit the need through a program like this.
The key components of the collaborative care model are the primary care physician, the behavioral health care manager, and the psychiatric consultant. The behavioral health care manager does the bulk of the work in this model. They are the ones who are doing brief interventions with the patient, such as motivational interviewing or brief CBT, cognitive behavioral therapy, and communicating between the patient, the psychiatric consultant, and the primary care physician. So the psychiatric consultant meets frequently, weekly, with the behavioral health care manager to find out how the patients are doing, how they are responding to treatments, to make any medication recommendations that they think might help as far as symptom management. And then the behavioral health care manager will actually relay those recommendations as well as the patient's progress back to the primary care provider.
We get together Tuesdays and Thursdays. It's about 4 hours a week in total, and truly just virtually, run the show through, an online service like Microsoft Teams.
With the collaborative care model, we use measurement-based screeners, things like the PHQ-9 to measure depression symptoms and the GAD-7 to measure anxiety symptoms. We complete those with patients on a monthly basis just to kind of gauge their symptom improvement. And what we've seen so far is that we are getting about a 60% reduction in depression and anxiety symptoms for patients who are actually participating in collaborative care.
The model can improve outcomes, I think, in a lot of different ways. For one, I'm very hopeful that it can destigmatize seeking mental health treatment all around. That's one huge part, but another huge part is, again, the expertise of a psychiatric provider or one of our behavioral health care managers who are well trained in various therapy modalities to be able to connect with them and provide that care in parts of the state where that care may not otherwise be available.